Thank you.
Thank you. Representative Holder-Winfield, followed by Representative Lavielle.
Thank you, Madam Chair. Nice to see you, Secretary. I wonder if I could ask you 4 questions in succession, and then you just answer them if you can remember them. That way it could go a little quicker.
Okay.
So I like that you talked about the reasoning behind why the budget was created. One of the things that's important to me is I look at the crisis that we have with the deficit, and I think about a crisis potentially coming down the road because of the changing demographics of the state. And so when I'm looking at the notion of job creation, I'm wondering, does your budget envision how to create jobs within the burgeoning population in this state? And so if you could talk a little bit about that, and if not, I would like to continue talks with your office about that. You talked about the low-income adults on Medicaid and the reduction in the benefits package. If you could actually talk about that a little bit more, because I was out of the room, so I'm not sure you actually articulated what that reduction means. Thinking about that population that I first mentioned, I was thinking about opportunities, and so I went to the higher education institutions, looked at Connecticut State University and UConn, and I looked at the reduction in the block grants. And I'm just curious if you could speak a little bit about the thought behind how you reduced the block grants in each one, because there's significant differences in how that was done.
Okay.
And then you coordinate in this budget a couple of offices into the Office of Government Accountability. And this is for reporting and various other reasons and sharing information, but all of those offices don't necessarily share information. So if you could just talk to us a little bit about if you think that this coordination gives us significant savings, or if there's something I don't understand about the information being shared back and forth, because I don't necessarily see the connection between all of those offices. Thank you.
Sure. The question of demographics and job creation, I think both within the new Department of the Board of Regents for Higher Education, within the Labor Department, and I anticipate within the Department of Economic and Community Development, we've had significant discussions about the need to ensure that our educational and job training and job creation activities are targeted in regions and in economic clusters, and I think appropriately demographically in ways that meet the needs of the state's residents. That we need to ensure that people are being trained for the jobs that are available, and that we try to recruit jobs that fill the needs of our residents. So I'm not as expert in some of those questions as others in state government, but I believe that it is our intention to begin to have greater coordination of our our job creation, education and job creation efforts and job training efforts with demographic information and the economic realities of the greater world, to ensure that we're, as an example, creating, having training programs that create people with the appropriate certifications or education or training or degrees to carry out the jobs that are in demand here in Connecticut, so that, obviously we want to create a better match going forward. I think there's an enormous demographic component to that, especially in the long term, that I think we will attempt to address. With respect to the LEA, the Alternative Benefits Program in LEA, we are beginning the process of developing. We will have to. An alternative benefits program is a term of art. It requires approval by CMS at the federal level, and we are just beginning the process of developing what that will look like between OPM and DSS. Some of the ideas that we are considering with respect to that are possibly creating. A couple of the concerns that we have with LEA are that there is no family income test, and yet we allow 19 and 20-year-olds into the program. We want to make sure that we're not providing services to 19 and 20-year-olds who have family resources to pay for their health care. Just obviously, we don't want to provide Medicaid benefits to people who don't need them. So that's one issue. We may look at providing some level of asset test. There was an asset test in Saga that disappeared in LEA. We are looking at some minor modifications to the benefit program in order to try and save money. Areas like the transportation benefit, to find more cost-effective ways to provide transportation for beneficiaries. Obviously, we're aware we're not going to. We don't think it's productive for us to add significant cost sharing. There may be a couple of exceptions to that. I actually believe that cost sharing on emergency room visits has a positive impact on utilization. In properly done, it motivates people to get their medical care through a primary care arrangement rather than an emergency room. But many other types of services, we would not look at cost sharing, but we might in some limited ways. We might look at some minor modifications of benefits, sort of like the changes that we're proposing in the optional benefits packages in other parts of Medicaid. For instance, reducing the dental benefit to be, that type of program is something that we would look at. I don't think we would make dramatic changes to the benefits. It would be slight changes in order to make it more cost effective. We obviously have not finalized what that alternative benefit package would be like, and we ultimately will need to likely negotiate that with the federal government. In the area of higher ed block grants, we adjusted the block grant request from the units of higher ed so that we believe that they were all reflective of a current services level. Some of the different agencies had calculated the impact of a 27th payroll or other factors differently. So we adjusted their block grant requests to show that they were all, we thought, comparably reflective of current services, and then we reduced all of them by 10%. So that was the basis on which we made the cuts to the higher ed block grants. Now, 10% seems like a very steep cut, and I certainly appreciate that. However, if you look at the total resources that are available to operate these higher education units, these cuts amount to more like 2 or 3% of the budgets of the higher ed units, which is commensurate with the reductions that other state agencies suffer under this budget proposal. So we thought it was even-handed. The last question had to do with the Office of Governmental Accountability. I wrote these down, by the way. My memory's not that good. The Office of Governmental Accountability, the cost savings that we envision at OGA have to do with reduction of duplicated administrative functions. Obviously, there may be some information sharing. That wasn't really our motivation. It has to do with the people who pay the bills, who answer the phones, who establish the budgets, who manage human resources, and carry out the administrative functions in those agencies. We also believe there may be some capacity for overlap. I mean, there are attorneys in a number of those different units, and they certainly could, provide backup or fill in for other areas. I mean, a freedom of information attorney could presumably serve to reinforce the staffing levels in the elections enforcement unit during an election season when there's a greater demand on their services or need for greater timeliness. But that's something that we didn't factor in any budgetary savings. We just thought that the combination of these groups would create some opportunities for improved services as they relied on their cross training of certain staff members. Bear in mind, we have not proposed any reductions in or eliminations of the independent commissions, which are statutorily charged with carrying out the sort of adjudicating claims or resolving the questions. So the Freedom of Information Commission would continue to exist. It would be staffed by attorneys dedicated to the FOI matters, but the person who answers the phone and the person who makes sure the paychecks and the other business aspects of the agency would be shared with across the entire office.
Thank you, Mr. Secretary. I have a long list of questions, so I'll send the rest of them to your office. Thank you, Madam Chair.